New data presented at the Cure SMA meeting relating to Nusinersen um, affected a cross section of patients from the pre-symptomatic nurture children, in which there was reports of bulbar function and swallowing issues. And what was noted is that they preserved swallowing. The dysphagia concerns were seen in a subset of the SMN2 copy number of 2, as opposed to children with SMN2 copy number of 3 who had no such concerns. And this has been a recurrent theme that we've seen with regards to motor outcome, and now we're seeing with regards to the oropharyngeal function that there's a distinction between copy number of 2 and copy number of 3, again reinforcing that the two are not similar, and early treatment of the SMN2 copy numbers has to be quite expeditious so that you don't lose motor neurons, because that's what's predicating these differences in these groups. The SHINE study presentation that I found novel was more on the 6-minute walk test that continued to show maintenance of function and some improvement in 6-minute walk test, distant walk. And that's in a very small subset of the CS2, CS12 open label study. Because there were no such patients included in the CHERISH study, which, as you all know, is only for SMA type 2 patients who were included. Another nusinersen-based trial in the Cure SMA meeting that was presented is the DEVOTE study. And this is a multi-part dose escalation study using higher doses of nusinersen than previously have been used. Um, the part A that was presented is a safety and tolerability study, and it was using 3 doses of 28 milligrams of nusinersen as a loading dose at day 1, 15, and 29, followed by a maintenance thereafter. So, the main take home message of this presentation is safety and tolerability of this part A of the DEVOTE study. And what that found is that there were no serious adverse events and no adverse events that were related to the study drug, because nusinersen was found to be safe. There was, however, about 24% rate of lumbar punctures or related to the intrathecal process, side effects, which are a very common finding and are self-limited and not unexpected. So, of the totality of presentations of the nusinersen studies, there were no earth shattering presentations that would necessarily alter our management of patients currently. I think one presentation that I found helpful was the Nurture study, showing us bulbar puncture in pre-symptomatic patients with nusinersen, that showed that it was preserved and that the gradient that is seen with nusinersen does not seem to affect um, bulbar function in pre-symptomatic patients who were treated, and that most of the findings were related primarily to SMN2 copy number. With regards to adult, there was addition to the literature of its efficacy in the adult population, which had not been quite as robust in U.S. cohorts. There has always been an indication for treatment with nusinersen in patients of all ages, so it doesn't really change our management. It just reinforces of its utility in all age groups from pre-symptomatic to adulthood.